and welcome to the Pulse podcast at Patterson Health Center. And I am here with Morgan. She does all of our mammograms. We are so excited to celebrate Breast Cancer Awareness Month. We have a lot of goodies in here. Morgan has prizes that she's going to give away to people with insurance and people whose insurance won't pay for this. So can you kind of tell us about this month?
Yes. So it is a very special month for those of you that do not have insurance or do not meet the requirements for a mammogram. The Harper County Health Foundation was very generous and is funding that for us. It's also just a good month to come get your mammogram. October is a pink month, and we appreciate pink, and so we're excited to give mammograms.
Absolutely. So we're going to start with the basics. For those who don't know what a mammogram is, can you kind of explain what a mammogram is, what it does, and...
Yes, so a mammogram is an x-ray of the breast. It's a pretty simple exam. It detects early breast cancer as well as other breast cancer diseases or any type of breast disease, and just an x-ray of your breasts.
All right. And so when should women start getting their exam?
Women should start beginning their screenings at the age of 40.
So I'm a little late.
Yes.
I'm 41, so.
Just shy of 1 year, yes.
Right? So what are some risk factors of breast cancer? If somebody comes in, they're a little bit concerned that they have a family history, what are some risk factors?
Yep. I would say the big one would be family history. It does run, genetically. So it's always good to do self-breast exams. And then if you do have a concern, it's always good to talk to your provider and go from there.
Okay. Mm-hmm. And so how should I, when I come in for my first mammogram, how should I prepare? Should I wear deodorant? And
yes, that's a good question. So we prefer you do not wear any deodorants or powders in the area. Sometimes deodorant can mimic calcifications, so we don't want that. And we do have wipes. If you do wear it, it's not a big deal. We do have something you can use to wipe that off. So yes, just come prepared without any deodorant would be great.
And is there anything else that people should not wear, or?
Possibly powders, lotions, just anything like that in the breast area or armpit area.
And why is that?
Just because it may show up on the mammogram, and we don't, depending what's in the ingredients, so we don't want to risk that.
Yeah. So what is the process of giving a mammogram? This is the machine right here. You can probably hear it a little bit, but that's all right.
Yes, so it's a pretty simple process. I know it seems a little intimidating, but you just come on in, and we typically take 4 images, 2 on each side, depending on if we get all of the tissue. But I try to make it as quick as possible, painless, comfortable, so yes.
And that was another question I was going to ask. I know a lot of people are a little bit fearful of getting them, whether they're painful or...
Yes, they are a little intimidating, but I would say they're more of pressure versus pain, and you'll be in control the whole time, so you'll tell me, that's too much, but I will do my best to make you comfortable, that it doesn't hurt.
So how long does it usually take to get results, and how does that work? Do you send results to people?
Yes,
or?
So we will send it off to be read by the radiologist, and then we get our reports back, I would say within a week or so, sometimes quicker, and then I will mail out patient letters, like notifications that of your results, and then your provider will also have those results.
And so what if somebody has, implants or piercings or a pacemaker? What should they worry about getting a mammogram? Or?
No, you can still get a mammogram even with implants. We just take double the pictures. We just want to make sure we see all that tissue with the implant and then with the implant displaced. So you can still have a mammogram. It's the same thing, just maybe more pictures. And then everything pacemaker, you can still have a mammogram. Sometimes it just may be in the picture, but I'm usually very careful of it and kind of, keep that in mind.
Right. And just be honest with her if you come in for a mammogram that you have something like that. It's great, no judgment. We're fine with it. And like I said, this month we are encouraging women to get mammograms. I think 1 in 8 women end up with breast cancer.
Yes.
This is actually how our free program started.
Yes.
I want to give a shout out to Amy Walker for really helping start this program to help women, because I think at one point there were 3 women under the age of 40 who had breast cancer in Harper County.
Yes,
so.
yeah, it's good that we do this and take advantage of it. And you know, if you have concerns, to always go see your provider too. Yeah.
Definitely.
Mhm.
All right. Well, is there anything else you wanted to add? Or?
I don't think so. I just want to thank the Harper County Health Foundation, though, for doing this. Yep.
Definitely. Yeah. All right. Well, thank you so much, and we will see you next time.